here's another company and a couple of gentlemen we're happy to introduce you to because they're in the business of creating a healthcare capability that's something you want to access, you are incented to access, and in all the different ways. So let's give you a hypothetical. Let's say a broken down old guy who has a hair loss problem and maybe ED issues, and I don't want to talk to my primary care doctor because I see him at dinner every Friday night. Where do they go? Say hello to Adam McBride and Dr. Halland Chen.
Absolutely.
Adam, tell us about Eden Health.
Absolutely. Well, that's a great question. I would say probably the first place, and I'm biased towards it, they probably want to go to Eden for that. But I think we have a lot of individuals like that where they have a great general practitioner, or maybe they don't even know their doctor that well, and they do know the problems that they're facing. Maybe they're facing problems with weight loss or ED or hair loss, and they're really looking for a place where they can get personalized care. And I think that's where Eden plays a huge role, is being able to be part of the conversation and being able to be part of what we call Healthcare 3.0, which is really about democratizing healthcare for all. Traditionally, you'd have to go into your doctor's office, talk to your doctor about it. He or she may or may not prescribe something for you. Once they prescribe it, you're going to have to go down to the pharmacy. You're going to have to wait for the pharmacy to be able to fill it, and then you go back and you pick it up.
And I assume they're not expert in every area where I have a need.
Generally, probably not. That's why they're considered a general practitioner. There are a lot of great doctors out there, and even your general practitioner will probably research one area more than another. Yeah. But when it comes to specializing a certain need that you're looking for, like weight loss, they might not be the specialist. And in fact, that's why general practitioners, sometimes you'll go and see them, and they'll say, "Oh, I don't specialize in that. I'm going to give you a referral to somewhere else."
They're the gatekeeper.
Exactly.
Dr. Halland Chen, tell us about your career before Eden.
So I'm a double board certified doc, and I specialize in pretty much sports medicine and interventional spine. So pretty much very early on in my career, I was very much exposed to how we were giving a lot of drugs and medications to help people, and I was even doing procedures like spinal procedures, and I kind of realized this isn't exactly the medicine I want to practice. I thought we were going to focus on healing people and helping them naturally. So I was pretty much in the functional medicine world back in 2010. So about 15 years ago, before it was even mainstream. We were doing a lot of things like testing and thinking about the gut health and whatnot. So it's kind of evolved. I've always been involved in the regenerative medicine space, studying things from PRP, bone marrow, stem cells from adipose and exosomes. So it's kind of evolved in how regenerative medicine and functional medicine are pretty much at the core basis, all about how your cells work.
You live in Miami, and you were telling me earlier you're pretty excited about a change in legislation which you think is going to have a profound impact on the area of interest you have in healthcare.
Yep. Florida is basically pushing a law where you can do stem cell therapy July 1st, so they're being much more open about it, whereas, we do stem cell research right now. It's under FDA studies. We have some phase 2 clinical trials, and that's because, in this research, you're expanding cells. FDA regulates your stem cells like a drug, but in Florida, with some of the new legislation, and we'll see what it ends up turning out to be, that actually can open quite a bit of a gateway so that people are more open-minded on seeking alternative therapies and treatments. And so I think that's where this is all about. How do we find things that are not quote-unquote mainstream? And that's where I would say your traditional doctor office may only know drug-based therapies, which are fine. Sometimes they're needed, but there's a lot of other things like peptides, which is what Eden specializes in, and other things that are very functional, which can be very helpful for patients, which is what I'm seeing. It's very patient-driven medicine now, because patients are much more educated. You've got Google, you've got ChatGPT. They're actually coming into the office already knowing to some degree what they want.
Adam, you're a serial entrepreneur. You've done some really successful things in the past. 2 years ago, what drew you to this idea?
I think the thing that really drew me to this idea was there's a couple things. The first one is being a father. I have 4 children, and having a professional career. You find yourself often putting your health second, and I put my health second. I used to weigh 50 pounds more than I do now. I felt like I was always busy, but I always felt like I was always tired. And again, being an entrepreneur, you're kind of looking at how you can sometimes solve your own problems. And I think that was one of the things that I started to look at, saying, and again, I'm not a doctor, so this is my medical opinion. He's a doctor over here. Is that a lot of my health stemmed from bad metabolic health, right? When you think about
what do you mean metabolic?
Exactly. So metabolic health, right, is what a lot of our underlying problems are, or the good parts are, right? So we have these things called metabolic comorbidities. So when you think about your weight or excess weight, that's excess adipose tissue on your body. When you think about type 2 diabetes, that's extra sugar going through you. When you think about high cholesterol levels, that's extra fat going through you. So a lot of these things are these metabolic comorbidities. So they're all intertwined with each other. And so what I started recognizing with myself is that, I had a lot of these comorbidities that were kind of just weighing me down as a whole. Mm-hmm. And so that's one of the reasons why we really started Eden, was to say, hey, if we can just simplify this, really simplify this for a lot of people, we can probably solve a lot of people's health problems from very simple mechanisms. And I think that's what really started. It was just understanding that the healthcare system was really complicated, and that really there's a lot of great specialties out there for very unique things, right? But it's just like, in my view, your health insurance should be for something like catastrophic. You break a leg, you need a surgery. But for everyday health, I don't know if you need to necessarily go to the hospital for that, mm-hmm. right? And so I think that's where functional medicine and Eden came to play in.
Now, how much did COVID and the rapid adoption of telehealth impact your business plan? Could your business plan have happened as quickly as it has without that?
Definitely not. So what happened was, because it's harder to see your doctor, there's a lot of different regulations where the government kind of got involved. So think, for instance, testosterone. Testosterone is a class 2 drug. And beforehand, you had to go see a doctor physically for that. Because it was hard during COVID, they allowed you to see an online doctor for these type of things. And so we saw telehealth start to spring up in there, because people started to see, like, oh, I can get access to these type of medicine and to these type of doctors online. The other part too, just besides COVID, is, as you start to notice, is like, we have a shortage of doctors in this country.
And it's only getting worse.
It's only getting worse. And so just getting great personalized care is really hard.
And it varies dramatically geographically.
Exactly. And so for us, that's part about the whole point of democratizing healthcare. And so COVID kind of accelerated that, saying, hey, you can have a doctor be remote, and they could see multiple patients, especially if they specialize in something, because they know what side effects to look for. They know what to look for pre-existing conditions, like if your family history has a certain type of cancer or anything else like that, how they should be prescribing medicine.
So do you have access to your patients' records?
Yeah, so the doctors have access, to the patient records. The patient will go ahead and they'll go ahead and put all the information in, and they'll provide.
The patient has to provide that.
They have to.
Can you tap into their primary? They go to a hospital that's on Epic. Can you tap into Epic?
Technically, you can, but again, with most medical professionals, what happens is when you do an intake, you have to list everything anyways,
yes.
right? Because the doctor has to be able to ask those questions all over again. So technically, yes, you could, but I think for personalized care, it's very important that the medical professional that you're dealing with asks those questions, so they know exactly what type of things you have. Because there might be something new that's not in there.
Dr. Chen, you've been a researcher, a clinician. What attracted you to become an entrepreneur?
I think it's just the nature of wanting to find solutions. Just like Adam said, I'm always trying to discover new pathways. I mean, in traditional medicine, we weren't learning about regenerative medicine, and we weren't learning about how do you decrease opiates for a patient. So I had to kind of find solutions that were geared towards that. And then a lot of my research is in the NAD world. A lot of the studies are in mice models, animal models, and so part of my work was actually to find a university-based setting, and then I realized there wasn't one. And so I'm a graduate of University of Miami. We started talking, and actually then it blossomed to something further. We would do a regenerative medicine, longevity medicine, and cellular medicine project where we could actually study NAD pathways, do high-quality university-based research, because that's kind of the hard part, is that a lot of people will just find their information online, but that's not always validated, and it might be just someone's opinion. And so I have a medical background, and then I'm very, entrepreneurial. It kind of just made sense. It just kind of goes hand in hand, especially if what you're seeing in the system isn't working, you have to actually spearhead it yourself.
How did you guys connect?
One of his colleagues worked with me on a previous project that was longevity based. So,
So how much of your personalized digital telehealth care practice at Eden, how much of that is around longevity? Now,
for me?
Yeah.
I mean, well, my practice is almost exclusively longevity / concierge medicine. I mean, I'm a bit of a hybrid doc where maybe about 30% of my time is actually being a clinician. The other 70% is combination of research, traveling, doing innovation. So I would say as I've gotten older into my career, I would say I'm still clinical. It's mostly to really hone in. You know, you never want to lose your skill set.
Yep.
But the other 70% is what it takes to actually find solutions.
Yeah, and one of the things that we found, especially with longevity, is I think it's great to chase the holy grail, but there's two parts of medicine that are really important, especially when it comes to yourself, right? You have lifespan and you have health span. So lifespan is kind of when you think about with longevity, it's like, you know, how long can I live for? Health span is how long can I live feeling like an 18-year-old, right? And so we do care about longevity. We do care about how long you live. And you know that's why we look at new functional medicine, things like NAD or these other type of protocols that we have. But more importantly, I think what we're really focused on first is really good health span, right? We want to make sure that everybody feels great every day. And so, you know, I almost like it to say, you know, some people, you know, they want to feel good, they'll have their coffee or their Red Bull. We're almost making it where like, you have your protocol with your medicine, your doctor, and you're taking that daily, and that's really what is, you know, not just making your life live longer, but also just making you feel great.
How do you find patients now?
Well, most of our members, we're an online company, and so they find us through education. We have a lot of blogs, but you know, of course, we have traditional advertising. But most of our patients find us through, again, all of our educational content. You know, because this is a new field. And there's a lot of education to be done. You know, for instance, our doctors will go out there and educate them about things, you know, for instance, whether it be NAD or methylene blue, things that they haven't heard about before, and educate them about, you know, the different things that can help promote or the benefits of it. And I think once people start understanding that and they start understanding that they can take more control over their own health, then they get more excited about it.
So your marketing plan, your marketing scheme is through information and helpful content.
Well, from a business perspective, I would say, you know, we're pretty good at being able to identify and work to provide the message to our customer. We mainly do a lot of traditional marketing, to be honest. That's mainly how we find our customers.
And what do you define as traditional marketing?
Traditional marketing would be, you know, your paid media, your paid social, those type of channels. But really, that's for a lot of the members who are already educated.
Yep.
They know what they're looking for. There's a lot of people who don't know about online medicine or that they don't know about personalized medicine. It's something that's very new for them. And so for us, it's more about educating people who have never heard about this. They're still going to their general practitioner every day. They don't know that there's this type of access or care. And so, you know, us is just getting the word out that, you know, we are a company online that you can actually trust. You know, we have medical professionals that you know, you can talk to at any given moment.
And these medical professionals work for you.
Yeah, so we have provider networks that we work with, right? We have some medical professionals in-house, and we have provider networks, depending upon the type of care that you're looking for. Again, you know, we have ones that do the prescribing of medicine. We have nurse practitioners.
And you also have a captive pharmacy.
Yes. We also are vertically integrating. So we have a pharmacy. One of the great reasons of having a pharmacy is when you think about the traditional model with PBMs and everything else, healthcare gets really expensive really quickly. Mm-hmm. And so for us to help create more affordable healthcare, we decided to go vertically integrated, getting our own pharmacy. And one of the reasons being is because we're just all cash pay. We decided not to do insurance at all because we said everybody should be able to afford this.
That's interesting. So it's a la carte. So you think people, some significant subset of the population should be self-insured for everyday healthcare?
I think everybody should have some type of healthcare, absolutely,
yep.
Right? I think it's more about, you know, like again, you break your leg or something else like that. But when you look at functional medicine, preventative medicine, which
yep.
I think most of us are now looking into, I don't know if using your health insurance plan is for that, right? It's like almost having car insurance and you use that to get an oil change.
Yep. So you change people's oil.
I guess.
How much of your business is built around GLP-1 drugs?
Traditionally, that's where we first started. So we almost took like an Amazon approach where they said, hey, for us to be successful, we're going to have to books first.
Yes.
And so what we recognize that
that seems like a logical place that people would say, hey, I'd like to tap into this, but I don't want to talk to my primary care physician about it.
Exactly.
Because he or she's going to tell me, yeah, you don't want to do that.
Yeah, so when we first started, we were very heavy on GLP-1s, but it was for a very strategic reason. was, we
It was new.
it was new, yes, and it's also a very effective peptide, right? And so a lot of people don't know about peptides, but they know about Ozempic, they know about Wegovy, right? But they don't know about peptides. And so GLP-1s are a peptide, and so there's a lot of great peptides out there, and peptides are nature, right?
Yep.
They're biologics. And so we said, all right, we're going to start with this very famous peptide that addresses a real-world problem that really people care about, which is their weight, whether it be because they want to look better, or they want to feel better, or whatever else it is. And from there, we've branched out. So it's still a significant part of our business, but now we've branched into other places like we do energy and mood, strength and cardio, and also we do longevity, hormones, hair.
Dr. Chen, you talked about the fact that you're a virtual provider. What's going on in Denver? That's not so virtual.
I practiced between New York, LA, and Miami, so was living in each of them at some point in time. I mean, virtual is kind of like relative, right? Because a lot of my patients, it's more boutique and concierge, so some of it's house call, some of it they come to my clinic in Florida, so it kind of just depends. I mean, I think for a large part of the things that we can do, you don't actually have to do, it doesn't have to be in person anymore. I mean, that's the benefit of knowledge, right? Knowledge is just what is the highest quality of information? What is the protocols? Can we get the test to them or the medication or the peptide to them? Unless you actually need a physical examination or a procedure, most things can be done basically online now, which is what we've discovered over time.
But what are you doing in Denver?
Oh, me in Denver? I mean, mostly didn't
you just open a place?
Yeah. So the Denver location is a new health club that we did, and so that was really to deliver on our promise of metabolic health. And with that, we kind of created this unique concept where it's a gym, it's a functional medicine clinic, it's a med spa, all in one. So again, we have about a 2,000 square foot gym in there. We have red light therapy. We have the sauna. We have.
You believe in this red light therapy thing?
Oh, absolutely. Red light therapy is great. I do believe in red light therapy. And saunas too. Saunas actually have a lot of good science around it.
Do they? Yeah.
Oh, absolutely. So anything we do has to be usually backed by science. And then of course we do things like beauty and aesthetics. We do Botox, facials, those type of things. So it's really like an all-in-one location for all the type of stuff. And of course we do all our peptide treatments.
Why did you choose to start that in Denver?
Well, the main reason was because one of our partners lived there, and he understands the retail space.
Yep.
And so myself, I'm located in Northern Virginia. He's in Denver, and it made a lot of sense. And there's just it's a
young, health conscious population.
It really is, right? So I think there's like two kind of health hubs like that. One's in Denver, the other one's in Miami. So probably our next one will be in Miami, closer to Dr. Halland.
It seems to me that there's a linkage here. I bet there's a good many of your patients are likely candidates for Dr. Patel's sensei capability. And by the way, you can make it from Miami to Hawaii, can't you, Dr. Chen?
That's easy. I was just in Dubai. That's short flight.
But it seems there's some great marketing collaboration possible there. What's next for the company? When we get back here next year, you'll be 50% older than you are today. What does the company look like?
Hopefully, I'll be younger from a biological age standpoint. That's the plan. No, I think our biggest thing is we really care about democratizing healthcare and helping more people. So, really, I think the future for us is first opening up more of these health clubs for things like in person, because we are an online business, but we also do believe there's.
And if you can do retail that works, it's the greatest. That works. I mean, you can do it profitably. It's the greatest marketing you can do.
It really is, because again, there's things, for instance, like we do things like testosterone and hormones online, but also sometimes hormones are great in person. For instance, like getting pellets, right? Pellets is an in-person procedure. Yep. And so it just really depends upon the type of care that's needed. And I think what we're starting to understand is like a hybrid model really works. And so I think as we look for Eden, we'll continue the hybrid model. And then we're also continue to vertically integrate more to bring down and make the prices more affordable for everybody and give our members more value.
We were chatting earlier about you called to get a dermatology appointment, and you were told how long?
A year. Yeah, I just had a dermatology appointment that took a year to get. And so I was worried because my father had a thing on the back of his neck, and it was cancer, so he had to have surgery on it. I got really worried myself. And so they tried getting me in, they couldn't, and so literally I just got in a couple days before this, and then I had to schedule my follow-up. and I tried to get something sooner. They couldn't do it, and they're like, sorry, we only have a year. So there's a lot of practices out there, I'm sure that you guys are all aware, where you try to get in with the doctor. It's 2-3 weeks, a year. It's really crazy right now.
I think there's a big opportunity there. Just dermatology, maybe you need some kind of in-presence there. Although cameras are getting better all the time. And there is some apps now that do diagnosis of skin conditions, right?
Yeah.
So a year from now, you're a lot bigger, and you've burned through so much more of that private equity money. How much private equity money have you taken?
Oh, well, we're all bootstrapped.
I love this.
It's been great, but there's a lot of pain at the same time. So we've been operating for 2 years now, and everything we do, we have to pay for cash. So like for instance, like the health club, it's a 5,000 square foot facility in Denver, Colorado, and we started off with
ponied up.
We had to pony up. Same thing with getting our pharmacy. These capital expenditures are not cheap.
There's a couple of people in the audience who are on the capital providing side of this healthcare world. I'm sure they want to be chatting with you later. Well, congratulations on the business you built, Eden. I think we're going to hear a lot more about it. It's an interesting space, and it just seems to capitalize on so many of the recurring themes we've had here today. So congratulations, and thanks for sharing your story with us.
Absolutely. Thank you for having us.
Thank you.